Okay, we are now joined by Adam Gaffney. Adam is a critical care doctor at Cambridge Health Alliance, an assistant professor at Harvard Medical School, and the former president of Physicians for a National Health Program, also known as PNHP. Thanks for joining me, Adam.
Thanks so much for having me.
So, you just last week testified in front of Congress to stress the difference that Medicare for All would make in your patients' lives. People may or may not be surprised to hear that this was actually the very first Senate budget hearing on Medicare for All. Could you discuss what you wanted to communicate to the senators and what you think the hearing means for the Medicare for All fight broadly?
Sure. I mean, I think the thing that I wanted to communicate was that this is an urgent priority for this country, and that was made clear by the COVID-19 pandemic. And there's a lot more I could have said, but the reality is, in the United States right now, if you get COVID and you are hospitalized, you could go bankrupt. The provisions that were in place to give some protection for the uninsured during the pandemic are now over. The uninsured program is done. It's out of money. That means there's no more money available for treatment, testing, or even funding the provision of vaccines. I didn't focus just on COVID, though. I focused on the fact that obviously there's a lot of illnesses, that people are being undertreated, that there's unnecessary deaths every year because of uninsurance, more than 30,000, that people are being harmed by copays and deductibles, not just financially, because that gets a lot of focus. I focus on the health effects, because that's what I do, the way it hurts people with asthma and cancer and so on and so forth. And then I did dive into the economics, because that is, like it or not, that's going to be a critical barrier and issue when trying to actually achieve Medicare for All. What will it cost? And we can talk more about that, but I did get into that and, explored the more than $400 billion in annual administrative savings that the Congressional Budget Office has projected starting 2030 if we pass this. And those are some of the things. And then I was joined, by Bonnie Castillo at NNU, Abdul El Sayed, a longtime progressive activist and Medicare for All supporter, as well as two witnesses for the Republicans. I hope, and Bernie said quite a lot as well, and I hope we made a powerful case for why this is the moment to get Medicare for All moving and push it forward.
So the Senate hearing also aligned with Senator Sanders releasing the new 2022 Medicare for All bill. What's your sense for where this new bill puts us regarding the timeline for winning single payer? And is there anything new within the bill that kind of changes our strategy for moving in that fight?
So, look, the Medicare for All movement has many parts, and I don't need to tell people that. There's activism among physicians, among nurses, in the labor movement, grassroots, DSA's campaign, and far more. And in the health policy realm, where I spend some time. The fact of the matter is, though, is that these bills really matter, okay? Because they give something to organize around. They give something that can push us, can ask us to push politicians about. And we've seen a really incredible turn, basically in the last 5 to 10 years towards Medicare for All, with very potent bills in both the House and the Senate that have had more supporters than ever before in modern history. So, the bill itself is a strong single payer bill. It has the good stuff that people are used to: universal coverage for everyone, effectively no cost sharing. Global budgets to finance our hospitals, to reduce waste, to ensure that we have healthcare resources where they're needed, not just where profits are. It covers most of the good stuff. In terms of where this takes us, again, the bill is only part of it. Of course, it's a good organizing principle, and it's something that can be achieved, and something that can be voted on, and something that we can push candidates on. But it's obviously only a small part of the broader fight, which really, I think, now is the moment when it needs to sort of, it's time for a second wind. I think one of the interesting things that happened with the COVID-19 pandemic is that it really did push Medicare for All to the back burner for a while, which is sort of curious, because on the one hand, I think the pandemic sort of made it clear why it would be useful, but people's minds were occupied on other issues. There were a number of, emergency support bills that were passed that helped to prevent a surge in uninsurance in 2020, which didn't happen. And there was, as I mentioned, the COVID uninsurance program. So you did see a patchwork that kind of kept things even, not great, even. But those are now falling by the wayside. Once the public health emergency ends, tons of people are going to be kicked out of Medicaid. Up to 15 million people will lose Medicaid when the public health emergency ends, according to one estimate. So we're looking a little bit down the barrel at things getting worse. And so really it is time to get back on the bus.
Yeah. Well, so to actually take a step back, how would you assess the movement fighting for Medicare for All so far in maybe the last decade or so? Where have we found success, and where are we hitting roadblocks?
Yeah. Well, I mean, there has been, I mentioned this earlier, but there definitely has been tremendous success. Obviously, not having achieved Medicare for All. I mean, when I first got into activism on Medicare for All, it was mostly during my residency in internal medicine in New York. And it felt very much like, okay, here's this idea. No one's really heard of it. It's a little bit out in the fringe. It's a little bit out there. Here's why it makes sense. And, over the course of my sort of period of time doing activism, I saw it swing into the center. I saw, mainstream politicians getting behind it. I saw a Senate bill that had, whatever 15 co-sponsors, whereas in the past, Bernie's bills had zero, only him was on it. And similarly, 2/3 of House Democrats had signed on to the Medicare for All bill in the House. So where has been the success? I mean, the success has been in, first of all, educational. More people are familiar with this than before. I think the success has been within certain healthcare worker groups, right? I mean, NNU has been a really powerful player pushing this forward. I think in PNHP we've seen we've really educated our physician colleagues, which is one of our main purposes. The DSA campaign has brought this to the broader left. And there's been success in getting more support from labor. So I think we've done a really good job on those fronts. I mean, the fact of the matter is, it's hard to say where we've fallen short, because the reality is that you're talking about a $4 trillion industry, extremely powerful. It was never going to be easy. And so the fact that we haven't seen a bill pass, I don't really, it wasn't likely that was going to happen that quickly. And we all kind of know that this is going to be a long, hard slog. And, even when, and I think when, not if, but I think when a bill is passed, even then, it's likely the bill will not be necessarily what we want. Exactly. It's going to go under attack immediately. Bernie's bill isn't enacted fully until 4 years after passage, 4 years to be politically sabotaged. So I think the way I like to think of the Medicare for All movement is, this is not a campaign to sort of, we're going to fight for this bill to be passed. Okay, the bill's passed. We won. We go home. This is basically a sort of lifelong movement. And even when we're not sort of achieving, I think the last thing I'll say is, even when we've sort of fallen short of, we have fallen short of actually passing legislation, we have moved the needle in ways that I think are often imperceptible. We've by sort of moving the center of debate and making Medicare for All the sort of standard progressive healthcare vision, we've forced the whole field to sort of shift at least somewhat in that direction. We've changed the discourse around things like cost sharing and deductibles. I think we've changed the tenor of the discussion, and hopefully that has resulted in some sort of invisible victories along the way by through that discursive change.
Mm-hmm. Well, so when I think about how other countries won some form of universal or free at the point of service healthcare systems, in almost all other cases, it seems that it either came directly out of labor parties or social democratic parties, or those parties applying massive pressure within their political systems. And then underneath that, there were, these programs had massive active labor movements made up of many unions pushing for change. Where are we in the U.S. right now with labor support for Medicare for All? And how do you think we can build greater support?
Yeah. Well, I mean, I agree with your historical perspective. I mean, if you look at the NHS, obviously emerged out of the labor movement. If you look at, Saskatchewan, obviously Tommy Douglas, and his party, and you see that in Europe as well. So I do think that this needs, yes, certainly to be part of a much broader movement that has to build on a labor movement, but even larger than that in this case, given the fact that labor isn't as powerful in the United States today as it was in a relative sense in those countries. So, you know, I think there's a lot of great work being done by on-the-ground activists, and I think I don't think there's any like magic kind of way to get there. One thing I would say, and because I think there's some people who can speak to the exact lay of the lay of the land in terms of which unions where better than I can, but I will say a little bit about the healthcare worker side of things because I can speak a little more to that. I think that's going to be a really important part of that. The part of this is having healthcare workers on the side of this change. We are going to be the ones who are working in this system, and that support will be crucial. And that support is also going to give the broader public and the general populace more faith in this reform, because if the people who are going to be doing it are in support of it, that says something. The other thing that so one more note on that. Which is that there is one thing that really differentiates us from the historic kinds of systems in the past is how much different healthcare is now in our country relative to where it was in Canada in the 50s through 70s, or certainly Britain in the 1940s. Even 40, and this is going to really affect activism. I think it's a really important point to draw out. Even 40 years ago, right? Obviously, there were private health insurance companies. Pharmaceutical companies operated as big for-profit firms. But in the healthcare delivery space, hospitals were mostly nonprofit, independent, so these voluntary, standalone organizations. Physicians were mostly sort of self-employed, kind of small businessmen, but small businesswomen, sorts of kind of system. And so it didn't really operate on the delivery side, what we think of as sort of a capitalist mode of production. That's changing rapidly, right? And that's something that, Gabe Weinine's book, The Next Shift, kind of elucidates, that that healthcare has sort of shifted into the commanding heights of the U.S. economy. And it's not just the insurers and the pharmaceutical companies, it's also those who are delivering healthcare. The big insurers are owning doctors' practices. There's vertical integration, horizontal integration. There's the coalescing of consolidation of these giant, sprawling, regional, monopolistic or oligopolistic health delivery systems. And that may not be the topic of what we're talking about today, but a greater understanding of that transformation and that logic is going to be essential to sort of figuring out where the stress points are, where the points of resistance are, where how healthcare workers orient themselves towards change. And so, yeah, it's an important part of all this.
Yeah. Well, so maybe just as a final kind of wrap up question, obviously part of this, a big part of this video is reorienting back to the fight for Medicare for All, which, like you said, it seems like we all kind of drifted away from for a moment, but hopefully there's going to be kind of renewed interest in this. But do you see any immediate or maybe intermediate healthcare fights that maybe aren't strictly single payer fights that you think are making real progress towards building power towards something like Medicare for All, or just kind of decommodifying healthcare in some way?
So, there's always been important fights. I think, obviously state Medicaid expansion fights have mattered. There's a push to privatize Medicare that PNHP has been involved in that I think matters. I think raising hell about the end of support for COVID care for the uninsured matters. I think raising hell about the, pushing millions of people off of Medicaid matters. The important thing is that we do that with a broader framework, of a broader Medicare for All framework, right? Because there are other people, talking about this, but what we need to do is tie it into the broader systemic issue so that it doesn't become a one-off issue. So I think that it's okay to work towards those kinds of intermediate sorts of endpoints, but I do think to be a Medicare for All movement, it has to be done in sort of as part of this broader push. And I will say politically, I think this is really the right time to get things back on track. For all the divisiveness about healthcare, it is a relatively it's an issue that does relatively cut across certain divides. And you see this with red states passing referendums in favor of Medicaid expansion, right? You see this is an issue that does allow us to push beyond the confines of, some of the culture war issues and those sort of things that can, I think, actually serve a uniting, unifying and politically useful kind of issue, in addition to being very important in its own regard, obviously.
Mm-hmm. Well, thanks again, Adam. Thanks for this, and thanks for all of the work you do around Medicare for All and around healthcare organizing.
If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.